for the Fall 2017 Educational Series. Today's webinar, entitled Mental Health Parity Accreditation, A Pathway to Compliance, will focus on the purpose and goals of CHQI's Mental Health Parity Accreditation Program, and how CHQI has begun working with national thought leaders to develop its parity accreditation standards. The conversation will be moderated by Michael Reisman, CHQI President, and will include perspectives from CHQI's Parity Standards Committee co-chairs, Brad Lerner, Associate General Counsel and Director of Parity Compliance with Beacon Health Options, and Connie Gaglietti, Director of Legal and Professional Affairs and Practice Directorate with the American Psychological Association. Before we begin, I'd like to go ahead and go over a few housekeeping rules. Today's conversation will be recorded for those who are unable to attend. Once the webinar begins, attendees' phones will be muted. Feel free to submit your comments and questions via the chat box on the lower right side of the webinar portal. Without further ado, I'd like to welcome Michael Reisman. Michael serves as CHQI's president, overseeing the development of all accreditation programs, service offerings, and external engagement. Prior to joining the organization, he served in the New York Attorney General's Health Care Bureau, which protects the rights of consumers in the healthcare system. While there, he led efforts to enforce federal and New York mental health parity laws, resulting in 8 settlements with health insurance companies that greatly improved mental health and addiction benefits and returned more than $2 million to consumers. Before Michael began practicing law, he was a mental health counselor in both inpatient and outpatient treatment facilities. Michael?
Yes, Tony, thank you so much for that introduction. And it's a real pleasure to join everyone this afternoon for this webinar. And I'm really excited for a number of reasons. First of all, this is the very first webinar that Clear Health Quality Institute has organized. So we thank everyone for taking the time out of their busy days to join us. I'm also very excited to talk about the Mental Health Parity Accreditation Program. I'm really honored to be joined today by 2 very special guests. And Tony, if you could proceed to the next slide, please. So Tony has introduced me, so I'd like to give Brad and Connie a chance to introduce themselves as well. We'll be hearing more from them later during the presentation, but Brad and Connie?
So I'll let Connie go first.
Oh, thank you very much. Hi, everybody. My name is Connie Gaglietti. I'm Director of Legal and Professional Affairs for the American Psychological Association, a position I've held since 2014. Before that, I was Executive Director for the Florida Psychological Association. I held that position for 10 years, and during that time is when I got involved with insurance and parity issues as it related to ensuring that consumers had access to mental health care. It's a pleasure to be part of this group.
Hi, my name is Brad Lerner, and I am Assistant Legal Counsel and Parity Compliance Director for a managed behavioral health organization called Beacon Health Options. We work in all sectors. We work in self-insured employer plans, the federal space, Medicaid, commercial health plans, and our sole focus actually is on mental health and substance use disorders. My personal background in parity has really been throughout my entire tenure at Beacon, and it is a primary sense of focus. So I was really pleased to be part of the accreditation efforts, and I've been really excited by the work. So I look forward to today, and hopefully you all have good questions, and we'll have a really good discussion. Thank you.
Well, great. Thank you so much, Connie and Brad. And to Brad's point, we are going to take questions throughout the webinar in writing. People can submit them via the chat function in the GoToWebinar. We'll leave at least 10 minutes for those questions. So we'll pause at about 12:50 to make sure we have time to address some questions. But we also wanted to say if folks have questions that we don't have a chance to answer today, or if questions come up later on, you can certainly contact us. We'll provide contact information on the last slide, and we'll also be reaching out to attendees of the webinar. I also wanted to say, in addition to questions about the material that we're going to cover today, we'd also love to hear from folks about what they would like to see in future Clear Health webinars. Before we end today, we'll give you a brief preview of a couple of the upcoming webinars, but we'd love to hear thoughts about other ideas. So the last point of on this preliminary slide is just a caveat. This is a work in progress. We are at Clear Health a new company. The Mental Health Parity Accreditation Program is a brand new program. As you'll hear, we are working through a process that has now been going on for about 7 or 8 months. We're still in the process. We have not achieved finality in any sense of the word on our accreditation standards, but at the same time, we've made a tremendous amount of progress. And as you'll see, we've really tried to create something that we feel at Clear Health very strongly is needed for a number of public policy reasons. And we just feel very honored that we have such a great group of people on our standards committee. If you can move to the next slide, Tony. So just a brief overview of what we're going to cover today. We'll talk about Clear Health Quality Institute. Then we'll go over some basics about accreditation in the health plan realm, just so we set the stage for the discussion of parity accreditation. We'll briefly talk about MEPA basics, the Mental Health Parity and Addiction Equity Act, and then we'll ask the big picture $64,000 question: why parity accreditation? Then we'll talk a bit about the challenges involved in creating the parity accreditation standards, and we'll conclude with some questions. So moving on to the mission and vision of Clear Health Quality Institute. As I mentioned, we're a brand new company. We have an ambitious mission, which is to improve the health insurance and provider systems of care by creating best practice accreditation programs and other compliance solutions. Right now, we're looking to become one of the top 5 healthcare accrediting organizations over the next 2 years by developing high fidelity standards and more efficient accreditation processes. And we are also at the same time trying to reinvent the thinking about accreditation and what it means by eventually focusing on outcomes as indicators of true quality. Moving on to the next slide, we right now are focused on 3 accreditation programs. The first is for telemedicine providers. This is a program that we have developed in partnership with the American Telemedicine Association. And this program is very exciting for us. We anticipate launching this program in the next few weeks to a couple of months from now. We're essentially expanding and developing a program that the American Telemedicine Association has had for a couple of years. What we're trying to do is expand the scope of that program, and we're very excited about that area because, of course, as most folks on the call know, one of the key areas in the development of healthcare these days is with respect to telemedicine. But we all have an interest in ensuring that telemedicine services that are provided maintain quality and safety standards. Here today, we're going to talk, of course, about the Mental Health Parity Accreditation Program. And the third program that's in development is an insurance appeals accreditation program. we're working on developing a uniform set of national standards reflecting current legal requirements and best practices to make the appeals system for health insurance more efficient, transparent, and fair. Moving on to the next slide, here's where we get to the foundational question. What is accreditation? The National Conference of State Legislatures defines accreditation as a process in which a healthcare organization's systems, processes, and performance are examined by an impartial external organization to ensure that it is conducting business in a manner that meets predetermined criteria. Now, it's a fact that most states today use accreditation of a variety of healthcare organizations as part of their overall strategy to evaluate and improve the quality and cost effectiveness of care and to promote compliance with state laws. At the federal level, there are a wide range of types of accreditation. One example is the CMS regulated accreditation for advanced diagnostic imaging, such as MRI, CT, and PET scans. In the health insurance realm, the Affordable Care Act codified accreditation requirements for certain functions. Under Section 1311, health plans offered through insurance exchanges must be accredited on various measures, including utilization management, quality assurance, complaints and appeals, and network adequacy and access. Then Section 2719 under the ACA requires external appeals under the federal process, for example, for self-funded plans, to be conducted by accredited IROs. So against this background of accreditation, we move to the next slide and we ask the big picture question. We ask the question, what are the reasons for accreditation from a health plan perspective and from a consumer perspective? So, from a health plan perspective, we're looking to create efficiencies through national standards. We have a third-party verification process. We supplement regulations and help reach public policy goals. We hope that accreditation will help payers improve their operations internally, differentiate themselves from the competition. There may also be economic advantages with respect to liability coverage or premium discounts. Really what we're trying to do with accreditation, I think, in any area is raise the bar and promote compliance strategies as well as best practices. Now, Connie and Brad, I wanted to ask each of you your perspective on accreditation. Maybe Connie, I'll start with you. What do you see as the advantages of accreditation from a consumer perspective?
Thank you, Michael. Well, I think one of the things that I've learned through this process is just how much analysis really needs to be done when it comes to parities specifically. And we're right now working on standards that helps lead insurers through this complex, comprehensive analysis. So I'm hoping that one of the outcomes of this exercise that it will lead to an insurance company being aware of where they might need some work to help them become compliant with parity, and also to promote their best practices. I think it's helpful for consumers to know that a company's been going through this process to deliver services that these consumers need so much.
Great. And Brad, from your perspective, what do you see as some of the advantages of accreditation?
So thank you, Michael. Thank you, Connie. As a part of the entity that would be accredited, or the payers, so to speak, we have done tremendous work in terms of parity compliance. And we are putting a lot of resources toward it. There's a lot of people analyzing it, And one of the things that we have found with this, complex law that, is reaching maturity and, there's new guidance always coming out, is just making sure that, with the different stakeholders involved, whether it's a state regulation, a self-funded ERISA plan, public sector plan, that we're, have some consistency in terms of what the expectations are for compliance. And even though, accreditation certainly doesn't subsume the role of any kind of regulatory compliance per se, it's going to create at least some sort of framework that will create that sort of consistency, that at least we could look, as opposed to our own internal interpretations, we can say, okay, here's a third body that has a framework, of things that they think would be important in reviewing when you want to ensure that parity is met. It's a really important piece for, different types of payers and plans, group health plans. And I think, the clarity that accreditation could at least help drive towards will really, enhance, the compliance with the law and really just ultimately help consumers. So some of this is just some ability to have some external entity involved in looking at this law as well.
Thank you, Brad. Let's get into the details of MEPA and what parity accreditation may look like. If you could move to the next slide, Tony. So, this slide is sort of tongue-in-cheek, MEPA in a minute. Obviously, MEPA is an incredibly complex statute, and by no stretch of the imagination is it possible to understand this statute in a minute. But given the time constraints of the webinar and the fact that most folks on the webinar are fairly familiar with MEPA, I think it's fair to say right now that there are three major areas that are covered in MEPA: financial requirements, quantitative treatment limitations, and non-quantitative treatment limitations. And we all know that the originally MEPA applied only to large group plans, but the Affordable Care Act extended MEPA to most small group and individual plans. And via the essential health benefit regulations, there is a mandate for coverage of mental health and SUD at parity for most small group and individual plans. And we're coming up on the 9th anniversary, of course, of MEPA, which actually we've passed the 9th anniversary. We're coming up on the 10th anniversary, which in part goes to the next issue or the next question to address on the next slide, which is, why are we engaged in this endeavor of parity accreditation? And there are a number of reasons. First of all, as Connie and Brad have suggested, the law is very complex. Health insurers and benefits administrators, as well as regulators, continue to struggle with how to show compliance. Of course, health insurance itself is incredibly complex. There was a study published in the Journal of Health Economics in 2013 about health insurance generally that found that only 14% of adults correctly answered 4 simple multiple choice questions about basic insurance terms. The enforcement regime for mental health parity is incredibly complex. If you look at the pie chart, that basically shows the type of insurance that Americans have. We have about 320 million people in the country right now. If you look at the upper right piece of the pie, about a quarter of Americans have self-funded ERISA plans, about 24%. Those are regulated by the US Department of Labor and the Department of Treasury through the IRS. If you look at the lower right corner, employer fully insured, it's about 20% of the population. There's joint federal and state regulation of those plans. As actually, if we could stay on the slide 10, please. Or we are actually slide 9. Thank you. And Medicaid, of course, is jointly regulated by state and federal. Then we have non-group, which is on the upper left corner, which are basically individual plans, are regulated primarily by the states with backup jurisdiction by federal agencies. Medicare on the left side, of course, is not subject to MIPA. There are some provisions of Medicare that have been recently enacted and implemented that do relate to mental health coverage. But this pie chart kind of illustrates the how complicated enforcement is in the MIPA realm, which is yet another reason to have a baseline for determining or testing compliance that would be provided by accreditation. Moving on to the next slide. So we're talking about the goals of Parity accreditation, and you see on the left, there's a photo of one of my favorite baseball players, Ichiro, who may be approaching retirement. The reason Ichiro is on this slide is that, in a way, his approach to baseball represents our approach to Parity accreditation at Clear Health. We are very focused on not hitting home runs, but on basically making contact, getting the issue right in the first instance. We're trying to develop an accreditation program that promotes compliance, that promotes best practices. We're trying to create a uniform set of standards that plans and payers can use to demonstrate a framework for assessing compliance with MIPA and to enable them to prepare for regulatory audits and market conduct examinations. We're not trying to replace the role of federal or state regulators, but we're actually trying to make, in a way, allow them to focus their work. So accreditation provides an independent third party's informed assessment that an applicant has conducted appropriate analyses that are reasonable and has implemented internal compliance controls, including vendor oversight, which is a very important issue in the Parity realm, since there are behavioral health benefits vendors, there are pharmacy benefits vendors who are involved in the Parity implementation. Through our standards and our accreditation, we hope to provide a template for regulators to structure their audits, reviews, and examinations. And we're also trying to educate the public, payers, plans, and regulators. Moving on to the next slide, we're going to start getting into the mechanics of creating the Parity standards. And we mentioned earlier that we've created a standards committee that is comprised of national experts regarding MIPA. We have the perspectives of health insurance companies, managed behavioral health organizations, provider associations, consumer advocates, and former regulators. We start with the regulations and the guidance. We have fidelity to what's been issued by the federal agencies, but we also are trying to fill gaps as needed. Our process has consisted of bi-monthly committee meetings, as well as subcommittees focused on the key elements, such as quantitative trim limitations and non-quantitative trim limitations. And we are, our main principle with how we're conducting the work is that we are encouraging a candid, respectful exchange of views. Now, I think it's fair to say that over the last 10 years and going even further back into the past, into the years before MIPA was enacted, there have been and continue to be divergent viewpoints on what parity means and how parity should be enforced. So maybe to turn things over to Connie and Brad, I'd like to get the two of you involved in the discussion here. And maybe Brad, if we could start with you. And
sure.
My question for you is, in the process of envisioning parity standards and looking at the regulations and guidance that's been issued and trying to develop standards for accreditation based on this body of regulations and guidance, what have you learned from that process?
Well, thank you, Michael, for the question. I think, as somebody who is, I've practiced in the insurance industry, but not specifically in accreditation, and a lot of members of the committee are not steeped in other accreditation processes. Obviously, learning about what accreditation is and how it works has been valuable. But getting to your the slide and sort of the interplay between, how does the regulatory framework or jurisprudence play in? I think, again, we have different stakeholders. It's kind of like the Rashomon movie, where you have just different people. The CHQI has gotten all the right people to the table, and different points of view on how to read these regulations. There are aspects of the regulations that are very black and white and mathematical and unequivocal, but unlike maybe other types of laws, this law, using terms like comparability, terms that haven't necessarily exactly been defined and may have some subjectivity to it, that sort of different stakeholder approach, different stakeholder interpretation, certainly learning from very, very bright minds, but also sharing. I think that this accreditation committee has had a lot of civility. So, I think that there is a component of just information share and heightened awareness for myself, and I think for many of the participants.
Thank you, Brad. And Connie, same question for you. What have you taken from the process of trying to develop accreditation standards based on the body of regulations and guidance?
Well, I want to echo Brad's comments, but additionally, I think what has struck me is how the stakeholders that have come together all represent different constituencies. They have different perspectives, and everybody is working together, though, to try to get a true understanding of where everybody's coming from. So, for example, I didn't realize that from the insurance industry's perspective, how much frustration they had in that they don't have real clear guidance, especially from state to state, where regulators may look to things a little bit differently and interpret things differently. So from an enforcement and compliance perspective, that was very interesting, because representing providers and consumers, we also see some of the shortfalls of parity where we don't know that things are being enforced the way we would like them to be. So as we go through this process of drilling down into the nuts and bolts of what the regulations and the laws state, and also looking at the guidance that's actually been given to us by the federal regulators, that's helped us kind of tease out some of the details. I mean, we certainly have a lot of work to do before we can come to consensus on some of these issues, but I think it's opened everybody's eyes, and we seem to be working together at least to try to understand each other's perspectives and hopefully come to some kind of a decision.
Thank you, Connie. Moving on to the next slide, this sets forth our basic framework. And as you can see in the image on the left, right now we just have the skeletal structure, right? We have a glossary that includes terms that are defined in the regulations, but also terms that are not defined. In terms of the accreditation standards, we have a set of core compliance policies and procedures. And as mentioned earlier, one particular area of focus is on vendor oversight, because one of the issues that's really, I think been an issue that's received a lot of public comment during the development of the parity regulations and in response to the various FAQs is some frustration that folks have expressed, and I'm talking in public now, not about the accreditation committee necessarily, but there's been some frustration that folks have expressed about vendor oversight. So what we're trying to do, in part with the accreditation standards, is address some of the gaps that perhaps have existed, and to clarify again that vendors, whether they're managed behavioral health organizations or prescription pharmacy benefit managers, should be and must work with their clients, with the health plans that they work with, to ensure that the parity tests that are required by the statute and the regulations are conducted. Then we have standards that relate to lifetime and annual dollar limits, identification and classification of benefits. And this is a key area. What we're really trying to do with this is set the stage properly for all of the analyses that must be conducted based on the classifications, right? So we have financial requirements, we have quantitative trim limitations, and then we get into what I think it's fair to say is the thorniest area of non-quantitative trim limitations. And what we're trying to do with our accreditation standards, and again, nothing has been finalized. We're working with a group of amazingly smart, amazingly passionate people to drill down on these issues. In the first instance, identifying the NQTLs, that's the first step, then classifying them, and then analyzing them for comparability, for stringency, both as written and in operation. And then we, of course, have the really important issue of disclosures, medical necessity criteria, denial notification, and MIPA analyses. Moving on to the next slide, we wanted to take some time to drill down on some of these key issues because, really this is, I think, the discussion for today reflects, should reflect some of the issues that have been percolating in the public realm with respect to the guidance that's been issued and the public comment. Looking at medical management techniques such as prior authorization, concurrent review, et cetera, what we're trying to do with the accreditation standards is provide guidance as to what the as written and in operation analyses should look like. I think it's fair to say with the as written analyses with respect to what health plans and benefits administrators do at the drawing board, at the conceptual level, in deciding whether, for example, to impose prior authorization for particular benefits, there's a range of viewpoints on what constitutes an appropriate analysis. And I think one point that's been raised in public, in comments, is that while some health plans have pointed to their qualitative factors, for example, that they look to in deciding whether to impose NQTLs like prior authorization, there are lots of folks who want to see how that is developed quantitatively, right? So when you have a factor such as high cost of the service or cost growth or something like that, that sort of factor can be analyzed in a variety of ways. It can be analyzed qualitatively, it can be analyzed quantitatively. So there's a spectrum of views. And I wanted to ask you, Brad, for your thoughts on this issue in terms of the spectrum of possible answers to the question of, what should an as-written analysis of a non-quantitative trim limitation look like? What's your sense of on this spectrum from quantitative to qualitative, what's your sense of, the guidance that's been issued by the agencies and the public discussion that's happened? What's your sense of,
Sure.
A proper analysis?
I do want to preface by saying slide 13, each one of these topics could be an all-day session. So there is, you know, these are the, I guess, more in the weeds on MAPEA, which, you know, given the maturity of the law, we certainly should be here, and that's part of the work and the mandate of this accreditation group is to begin to have these discussions. You know, and I also just want to echo back to one of Connie's earlier points about the different viewpoints. You know, we on the payer side, and I can only speak for myself, you know, we certainly view ourselves as advocates as well. And when you look at something like non-quantitative treatment limitations, always keeping in mind, you know, the goal here is to make sure that members and consumers get the right level of care, that they get access to treatment, that there's no discrimination for behavioral health treatment, the proliferation of behavioral health treatment. That's, you know, that's just good citizenship and good business as well. So, you know, these goals are always in the forefront of our mind. And to answer your specific question, you know, I think, you know, in terms of the guidance and MAPEA, you know, talking about processes, strategies, evidentiary standards, these are the key phraseology, you know, for any of the NQTLs, and ensuring within a category that those are codified in a way that consumers can understand that there's not discrimination happening on the behavioral health side. I think, you know, from my perspective, you know, we want to make sure that we're not overloading the members. We're not certainly looking for a particular constituency. We want to make sure that it isn't a numerical type of thing. You know, the regulators rejected that per se. So, you know, we are just trying to figure out what would be helpful, how that information should be packaged, what information exists, you know, what wouldn't be overwhelming. There's a lot of different things there, Michael, that, you know, as we've been talking through that. But so, you know, maybe to answer your question in one word, you know, we want a reasonableness to this interpretation, to be sure. And I think, you know, we want to make sure that it makes sense. You know, a consumer, you know, has to be able to understand, and it has to be easily accessible, the type of information.
Well, thank you, Brad. Connie, what are your thoughts on that issue?
Well, and then I appreciate Brad's comments, and then coming from the consumer and the health provider side of it as well. While we appreciate that the insurance industry also views themselves as advocates, we also need something to, I guess the trust but verify model is the best. And I think that's one of the things that our group has struggled with when it comes to how in-depth the analysis should be and what kind of information should be divulged. We also have been looking towards, like, where there's smoke, there's fire. So if we're working on possibly coming up with some kind of a compromise that if something smells fishy or looks fishy, that we might want to get more information. But we also have to remember that the accreditation is not at compliance with the law. We cannot say that if you are accredited, you're compliant. However, we're hoping that that is putting the companies on the track to compliance should they go through a review, and also inspire the best practices. I hope that answers your question.
Yeah, it sure does. Well, thank you so much, Connie. And I just wanted to echo the point that you made that accreditation does not confer any sort of judgment about compliance with the law. You know, in this context, you know, as mentioned earlier, there are some areas in which accreditation, for example, under the Affordable Care Act, is a baseline requirement. But there's no requirement, obviously, for Parity accreditation. But here, what we're trying to do is establish a baseline uniform set of standards. And again, it's not about an assessment of compliance with the law, but it involves an assessment of implementation of certain processes, the evidencing the fact that the applicant has conducted the appropriate tests. The other point I wanted to make in response to Brad is that you know, it's the point about making the as written and in operation analyses understandable to the consumer. And this really relates to the last point on the slide of MEPA compliance disclosures. That's a point that's well taken. But I know a lot of folks out there have raised the equally valid point that often the individual who is requesting MEPA compliance information is doing so on behalf of a member as their authorized representative. So you might have a provider, family member, or other person requesting information, and many of those people have a much higher level of sophistication than say the average consumer might, as reflected in the Health Economics Journal study. So that's again, these are the sorts of issues that we're dealing with in terms of calibrating what the appropriate level of disclosure is and what it should look like. And again, we don't have an answer to that question yet, but we believe, from a Clear Health perspective, we believe that we can get to some consensus or level of baseline for the disclosures. And from my personal perspective, having worked in this area now for more than half a dozen years, it seems to me that the disclosures, the type of analyses that are publicly disclosed for purposes of this accreditation, are the types of things that we'd want to see from applicants. So again, there's some discussion about where the numbers fit in, for example, with respect to factors or with respect to the in-operation analyses. There's lots of discussion about denial rates in the various guidance pieces that have been issued, in particular recently in the Medicaid parity realm. And I think it's fair to say that right now there's no consensus on what role things like denial rates play in parity analyses. But to Connie's point, I think that what we're trying to look for here are ways to indicate to a health plan things that they may need to take a closer look at. That's really what the denial rate issue is about, and other issues like it. It's about how to identify issues that require further due diligence. In the interest of time, I think we're gonna just touch very quickly on the issues of provider reimbursement rates and network adequacy. And these sort of go hand in hand because, as folks probably are aware, there's a lot of discussion about whether reimbursement rates for mental health and addiction treatment are adequate, whether the networks are adequate. I think there's recognition that there is a workforce shortage. This was noted in the Opioid Commission report that was issued last week. So this is a particular area that's very challenging in the parity enforcement realm. And I wanted to briefly turn things over to Brad with the question of, with respect to provider reimbursement rates. I mean, this is something where, again, there's a whole spectrum of potential analyses that can be done, from a high level looking at qualitative factors to, a very detailed level of looking at particular rates in particular areas. And from your perspective, Brad, with respect to MEPA compliance, and you've had experience, dealing with lots of regulators at the federal and state level. I mean, is there an approach that you think makes sense to this issue?
Yeah, thanks, Michael. We certainly recognize that, reimbursement rates are as one of the term is enumerated in the final rule. Network adequacy is also referenced somewhere in the rule. To your point, we certainly, it's hard because parity isn't necessarily the panacea for things that are broader. We all recognize, to your point, some of the workforce shortage issues and some of the larger issues in terms of how to address, mental health provider macro sort of points of view. But with respect to this sort of NQTL analysis, we're always focused on methodology, and disparate results, do not indicate it a parity problem. So, just really making sure, it's hard when you're looking at, again, numbers with a non-quantitative. So it's easy to say, well, there's sort of these two different rates. What does that mean? How do you, and then if the methodologies are not sort of objectively published methodologies, what are the sort of, going back to a word that you used earlier, what are the factors that go into some of these decisions, and sort of breaking it down sort of like a recipe, and making sure all the ingredients, line up in a comparable and no more stringent way. But as you point out, there are challenges with that. Certainly on just maybe on the network credentialing, it's a little bit easier. A lot of plans, use, other accreditation bodies like NCQA standards or state requirements to help bolster, that there is that comparability on both sides.
Well, thank you, Brad. And Connie, from your perspective, how do you think the issue of provider reimbursement rates and network adequacy is best approached?
Well, if I had the answer to that, I think I'd be making a lot more money. But we have seen from our perspective that there is a clear connection between reimbursement rates and network adequacy. It just also makes common economic sense. But ways to help measure that, and what I mean for network adequacy, would also be looking at things like how long does it take a patient to get an appointment with a provider of their choice? How long do they have to wait before they get an appointment? How far do they have to travel? So there are other things that can be used to gauge how adequate a network really is. But to go back to the point also about doing the comparison with reimbursement rates on the medical surgical side, I think that's one of the frustrations with MPIA, is that it is so difficult to get information from the medical surgical side in order to do the proper analysis. So perhaps back to your question, Michael, one way to approach it would to somehow make it easier for plans to access the medical surgical side so that they can do the proper analysis and show their work, if it does look to be a problem.
Yeah, I think that's a very good point, and thank you for your comments, Connie. And sorry, I didn't mean to put you on the spot too much, but hopefully, if we answer all these questions at some point, we'll know that we're really making a difference for people out there. I would say that the this question really is, this again goes back to this vendor oversight question, that getting information, making sure that the med-surg side is involved in the Parity compliance process. Because one of the things that I've heard just generally over the last 5 years, and this precedes my work with Clear Health, is that because Parity was MIPA was enacted in 2008, there were lots of, obviously, things were done a certain way on both the med-surg side and the mental health and SUD side before that, and these sorts of analyses that are required by MIPA, that are some of which are reflected on the slide, and by no means is this slide in any way exhaustive. These sorts of analyses were never done before, right? So we all understand that. So what we're trying to do now, almost 10 years after the statute was enacted, is come to some sort of working arrangement or working understanding of how the analyses should be conducted going forward. Now, whether or not they were done in 2011, 2013, 2016, if they were done, great. If they weren't done, that could be problematic. But with respect to Parity accreditation, we're really looking for the future and to promote a set of best practices. I also just wanted to remind folks on the webinar that we're open to questions. So if folks have any questions that they would like to submit, please feel free to do so via the chat function. Moving on to the next slide. This just provides a brief overview of the future anticipated accreditation process that Clear Health is going to implement in this area of parity accreditation, as well as in the other areas that we've outlined earlier in the call. We have an online application. We have a Clear Health review of the application. Now, in particular, in the parity realm, what we envision is a team that consists of an administrative, a clinical, and an actuarial reviewer, really digging into each applicant's submission, which will include narrative statements as well as required documentation. Then accreditation applications are summarized in reports that the team of reviewers create. Those reports would be considered by the accreditation committee. There basically is a decision as to whether full accreditation would be granted, whether some corrective action would be required, or whether an application would be denied. And in that last scenario, we have some due process protections built in terms of appeals through the accreditation committee and to the Clear Health Advisory Board. Moving on to the next slide. We're looking at our next steps going into 2018. The Parity Standards Committee with Clear Health is going to work towards consensus on some of these issues that we've discussed today. Then eventually we hope to move into public comment and beta testing and eventually approval of the standards. But we also understand that there is a need for ongoing evaluation and improvement. And so the first generation of the standards that we hope to see finalized in 2018 by no stretch would be the last word on parity. There's certainly, this is an area that's constantly evolving, and we would expect to see changes in the standards going forward. The next slide gives a preview of some of our upcoming webinars. A week from today, November 15th, from 1 o'clock to 2 o'clock Eastern Standard Time, we have a webinar on our telemedicine accreditation program. And then on December 6th, from noon to 1 p.m. Eastern Standard Time, we have a webinar that focuses more broadly on Clear Health and the programs that we are, that we're developing, both the ones that were represented on the slide earlier today, as well as some other concepts that we have in development. So moving on to the next slide, it's time for some questions. And let me see, we have a question here from a participant, and I'll just read the question out. Our state has conducted parity analyses of commercial plans and insurers, culminating in findings being issued to those entities for correcting compliance deficiencies. Since then, many plans have made progress in complying, whereas others continue to demonstrate a lack of compliance. Please speak to how accreditation might assist plans, insurers in maintaining MIPA compliance after being examined initially and found not to be in full compliance. Wow, that's a challenging question. This really relates to I think the issue that we've discussed a little bit today of the relationship between accreditation and compliance as assessed by regulators. I would say from my perspective, as mentioned earlier, one of the goals of parity accreditation is to educate. And I think what we're trying to do with what we will try to do with health plans and benefits administrators is make sure that they up their game. Now, some entities might, be very well prepared to provide the requisite required information to regulators. others might not be. But I would guess in the scenario that's outlined in the question, where an entity has not demonstrated full compliance as determined by a regulator, I mean, that's something where from an accreditation perspective, we would need to see a corrective action, right? We would provide, in terms of the accreditation process, due process to an entity, to an applicant that is making a good faith effort to comply with the standards, but we would expect that they would take steps to develop the tests that are required, to implement them, to get the right people involved. Brad and Connie, this is a tough question, so I was wondering if either of you have thoughts on it. I mean, really the question again is how accreditation might assist plans and insurers in maintaining compliance with MIPA after compliance issues have been identified.
I'll just jump in really fast here. I think, Michael, you covered it, but I do think on the front end, before we even get to maybe a non-compliant situation, having a level set understanding, maybe some more uniformity in terms of once an accreditation module has been passed and different states take a look at that and see that there may be some syncing up on the front end, maybe, that would seek to solve maybe some back end, non-compliance.
Thank you. Connie?
Yeah, I agree with that. I think also the fact that the accreditation criteria will be ever evolving, it might be useful to see what kind of orders are being issued by state regulators that the applicants themselves would be reporting, and perhaps that would even highlight some areas in the accreditation standards that perhaps we could beef up in order to take on this education role, and as Brad said, make it a front end criteria to help these plans do their best practices.
Well, thank you. I think those were both excellent points, and just to touch again on the next steps going into 2018 in terms of public comment on the parity standards criteria, we would hope to get some comments from state and federal regulators regarding the standards, and certainly we would hope to embody best practices and experiences in the standards going forward before they are in fact finalized and before any entities achieve accreditation. Well, we are almost out of time, so I wanted to take this opportunity to thank everyone for attending today and provide my contact information, M. Reisman, R-E-I-S-M-A-N, at chqi.com. Our website address is www.chqi.com. We're on Twitter as well, and as I mentioned, we'll be reaching out to folks who are who've joined us today to follow up. But I finally wanted to thank everyone, and in particular Connie Gaglietti and Brad Lerner for their time and really great comments today. Hope I didn't put you on the spot too much, Connie and Brad.
No, thank you for letting us participate, Michael.
Yes, thank you, Michael.
And again, we are continuing in this process as mentioned. We hope to have more webinars on the Parity standards development and the Parity accreditation program in 2018. So we look forward to further webinars and further discussions and communications with everyone on today's webinar.
Thank you for attending today's webinar, Mental Health Parity Accreditation, a Pathway to Compliance. We hope that this discussion provided insight into the new CHQI accreditation program. In the coming weeks, we will provide you with important updates regarding this new program. We invite you to join us for the next installment of our Fall 2017 educational series, taking place 1 week from today, where we will discuss why one size doesn't fit all for telemedicine accreditation. Please join us for a robust conversation on Wednesday, November 15th, 1 to 2 p.m. Eastern, as we showcase the only accreditation program endorsed by the American Telemedicine Association. Thank you.